What if I told you the problem isn't your age, it's not your testosterone, and it's definitely not just getting older? In fact, most men over 50 are dealing with something far more specific and far more fixable. Because what's actually declining is not desire, it's blood flow. And once you understand what's really happening inside your body, everything changes. For decades, men have been told a very simple story. You're getting older. Of course things slow down. But that explanation is incomplete and, honestly, misleading. Because many men still feel the same mentally. The interest is there, the attraction is there, the intention is there, but the body, it doesn't respond the same way anymore. And that disconnect creates frustration, not because something is wrong, but because something very specific has changed. Let's break this down clearly. Every physical response in your body, especially performance-related, depends on one thing: circulation. More specifically, how well your blood vessels can expand and deliver blood where it's needed. And that process depends heavily on a molecule called nitric oxide. This is the signal your body uses to tell blood vessels, relax, open up, let more blood through. When nitric oxide levels are high, blood flows easily. Response is fast. Performance feels natural. But as you age, that system starts to weaken. Most men don't realize these are happening. 1. Blood vessels become less flexible. They don't open as easily as they used to. 2. Cellular signaling slows down. The communication between brain and body weakens. 3. Nitric oxide production declines. This is the big one. Less nitric oxide equals less expansion equals weaker blood flow. And here's the key insight. Your body isn't broken. It's just not getting the same signals anymore. Now here's where things get interesting. Most men try to solve this problem the wrong way. They focus on testosterone boosters, quick fix pills, random supplements. But those don't address the root issue, because if blood flow is the problem, then anything that doesn't improve circulation is just treating symptoms, not causes. You can have normal testosterone, strong desire, good overall health, and still struggle if your blood vessels aren't responding properly. Now let's talk about something more interesting. There's a natural pathway in your body that produces nitric oxide, and it starts with amino acids. One of the most discussed ones is L-arginine. But here's the problem. When you take L-arginine directly, a large portion of it gets destroyed during digestion, so your body never gets the full benefit. This is where things change. L-citrulline works differently. It gets absorbed more efficiently. It travels to the kidneys, then converts into L-arginine inside the bloodstream, which leads to higher nitric oxide production, better vascular response, improved circulation. Now let's talk about something that's rarely explained properly. How you take it matters. Some people experiment with sublingual use, placing powder under the tongue. The idea is simple. The area under your tongue has tiny blood vessels. Some compounds can enter circulation faster. So instead of going through full digestion, they may reach the bloodstream more directly. Timing strategy. Many people take it 15 to 30 minutes before activity. But here's the nuance. This is not like flipping a switch. It's more like priming your system, supporting a pathway, enhancing a response that already exists. Now let's ground this in reality. Because this is where a lot of content online goes wrong. Important limitations. This approach may help if the issue is mild, the cause is circulation-related, but it may not be enough if there's nerve damage, advanced diabetes, severe vascular disease, medication warning. If someone is using blood pressure medication, nitrates, cardiovascular drugs, they should always consult a doctor first, because anything that affects blood flow also affects blood pressure. Here's where things get deeper and more useful. Because supplements alone are not the answer, they're just one piece of the system. The real stack that works. If you want real improvement, you combine 1. Circulation support like citrulline or similar pathways. 2. Movement. Even light daily walking improves vascular function. 3. Sleep. Poor sleep destroys nitric oxide production. 4. Hydration. Blood volume and flow depend heavily on this. 5. Reduced alcohol. Alcohol directly suppresses vascular response. You don't need extreme changes. You need consistent, small upgrades. Because circulation is not built overnight, it's built daily. Here's something rarely discussed, but incredibly important. When your body responds better, your confidence changes. And when your confidence changes, your entire experience changes. Because performance is not just physical, it's neurological, psychological, emotional. And when all three align, that's when things feel like they used to. So instead of asking, "What's wrong with me?" start asking, "What system needs support?" Because that shift alone changes everything. You stop chasing random solutions and start understanding your body. So the next time you think about performance, don't think in terms of age. Don't think in terms of decline. Think in terms of response. Because your body may still have the ability, it just needs the right signals, the right support, and the right environment to respond. And once you start seeing it that way, you realize something powerful. It was never about losing something. It was about understanding something. And in the next video, we're going to look at another everyday habit that seems completely harmless, but may be quietly affecting your circulation, your energy, and your long-term health more than you think.